We want to hear from you. In addition, during this program, you can ask questions at any time using the chat. Lisa will collect your questions and ask the speakers whenever there is time. While we were talking about chat, let's do a little more touring of your Zoom screen. At the top right is an option for gallery view or speaker view. The location on the screen may be different depending on your device. If you want the person who is speaking to show up larger on your screen, choose speaker view. If you select participants in the Zoom menu so that you can see a list of the participants, you will also find some options to signal to us. Raise hand, yes, no. To practice this, please click raise hand. In part 3, we will ask you to use the raise hand button and wait until we invite you to ask your question. To stop raising your hand, click the button again. I'm now going to invite Karen Gorgera, President of BPW Canada, to get us started. Karen, you're muted.
Yes, I am. Thank you, Catherine, and it's certainly a pleasure to be here today. My name's Karen Gorgera. I'm the President of BPW Canada and was elected at our first virtual convention in October, so I'm honored to be in this position. On behalf of BPW Canada and our BPW London Club, I welcome you all today. It's very appropriate that BPW Canada has worked on this event with BPW International this year, the same year as we are both celebrating our 90th anniversary. So in Canada, we have 23 clubs with members in 7 provinces across the country and 4 different time zones. So just as COVID has shaken our world, it's also changed the way BPW operates at every level of the organization. Who would have thought this time last year we would have had so many virtual meetings and opportunities such as this to see and learn from our BPW sisters from around the world? We all know that COVID has impacted everyone across the globe, and today's meeting will help us learn more specifically what that impact looks like, as well as some things that BPW members can do to make a difference and what BPW clubs from around the world have done. So I look forward to an interesting and interactive meeting. So even though she needs no introduction, it is my pleasure to have the opportunity to introduce our BPW International President, Margarita Yasuda. Dr. Mani has been the president of BPW International Federation of Business and Professional Women since 2017, and her theme has been empowering women to realize sustainable development goals. She has worked very hard to bring attention to the SDGs these past 3 years, so this webinar fits perfectly into that theme. So without further ado, I'll pass things over to President Amani.
Thank you very much. Thank you, President Karen. I am so happy really and delighted to be among all of you. And I really thank BPW Canada, BPW London, especially President Karen and all her team, Catherine, Lisa, and Kelsey, because what you did really is very important. This webinar is not only about COVID, but it's about the survey beyond COVID. It's a statistics of really how the COVID have affected our women across the world. And this is really the competitive edge of this webinar, is that we have already sent this survey to all over our affiliates across the world. And maybe it will be the nucleus for further research in order to make sure that what has really affected our women on the ground, whether politically, socially, economically, what was the efforts done by all our countries across the world in response for the COVID, and what was the advocacy efforts that has done also by our affiliates across the world in order to have incentives and policies from the governments and also from their constituencies, and what we as BPW International are doing across the world. I would like also to thank you and women, Anna Faith, for being with us, and because it's very important as BPW International with our partners across the world, as you and women, to see how we advocate for the policies and work closely with you and women in order to drive the agenda for women empowerment across the world, but also to see how we as BPW International is contributing to the global agenda. As my sister and friend Karin said, President of BPW Canada, our theme is empowering women to realize the Sustainable Development Goals. And within these themes, the 17 goals, how we as BPW International working for no poverty, for no hunger, for education, for health, for gender equality, for economic growth and decent work, and all until the 17 water, empowering women at all levels, and also for sustainable development goal number 17 with partnership. So our partnering even with UN Women with our advocacy agenda with reference to women empowerment principles. I am happy to have with us also Anna Faith, because she is heading the economic empowerment at UN Women, and she is also leading the WEBS teams. So, and I am also happy, thank Dr. Kate for being with us, because she will be really talking about the survey on a research and academic base, because this is the most important. What we are doing today is a feedback from all of you on the ground on what this COVID, how it affected us, and what could be our contribution to counteract the negative impact of the COVID. It's also my pleasure to say that we have here examples with us from different parts of all over the continent, so that we will hear to them. And we have from Sierra Leone, my sister Agatha, we have from Brazil, Margarita, we have Geraldine, who has been a chair for the international, for intercontinental meetings in online. So it is very important really also to tell you that I would need all of you all to see how we can enrich our booklet of the BPW International COVID response. And I have already shown it to many of you around the world, but I want to stress on what we did about those 10 pillars of how we did BPW International COVID Fund that we put, advocacy efforts with the governments to make laws and legislation incentives for women in different fields of business, education, online webinars for health awareness and business development, media campaigns for reaching out to the women and the stakeholders, business catalogs with promotion of women owners of SMEs, community services supporting communities and women household, food security and donation of food, healthcare preparedness and health awareness, social protection providing support and shelters for women suffering from violence, which has been increased during the lockdown, and training and capacity building of women. Of course, we have all shared this booklet. You see in Africa what we did in Egypt with advocacy efforts and donating food. And about Sierra Leone, I think our sister Agatha will talk about what she did in Sierra Leone with reference to donation of medical supplies. Nigeria did a great job also with training women in order to make hand sanitizers and to see how they partner to distribute hand sanitizer. Ethiopia, they gave food packages. Same did Morocco, but also did educational articles. And Cameroon, they built capacity and make hand masks. And in Kenya, they donated for the hospitals. In Cotonou, they also made donation. And Asia Pacific, they also had Singapore. They did also stay home safe and make awareness campaigns. Hong Kong did donation drive, public health awareness, and advocacy efforts with reference to also BPW Bahrain supported donation online and also make best practice for policies and actions so the government can give incentives for the women. BPW Malaysia has also given a lot of donations and for food stuff. Thailand did Thai shop, which is a very important how they make a shop online in order to promote the women entrepreneurs. Bangkok had give donation to everybody, and there is a lot, of course, in Thailand. There is a lot of advocacy efforts, even for the school and for the food donation. Nepal has did also training for the women to do the masks, the hand masks, and they also gave food donations. And they give stuff also distribution. You can see. And also with reference to Japan, they did advocacy efforts with the Prime Minister to involve more women. As you see, these photos have only men. They sent to them to have involve more women on the tables. Europe has did also great advocacy efforts. Malta has did a very program for incentives with the government. And they in Cyprus, they made awareness campaigns and advocacy efforts. Spain, they did many things about Rescue Me Entrepreneur, business development, help me in time of the crisis. Croatia has did a great one, Pula, with reference to a catalog online, having all the clusters that is present, and they have a lot of for promoting the women online. Ireland has did several seminars with reference to presenting policy and incentives for the governments and health awareness campaigns. Italy has also social solidarity and health awareness campaigns, advocacy efforts with the governments and Prime Minister and with the European Commission. And Estonia has also organized series of webinars to promote health awareness. BPW France, Leone, you are here, Monique. You have did a great with organizing Zoom meetings also with reference to equal pay and the electronic management of your documents. We can also see that BPW France National Board has worked on the participation for UN meetings, and voices of BPW France, Austria, and Germany for the equal pay campaigns. So even in Istanbul, they also did a lot of public education. Latvia, microgreen, they promote. Austria, the marketplace in Austria on Zoom. Athens and Greece, they did health awareness, education online. United Kingdom, they did a great job. They really sent to their Prime Minister to ask for the use of SDGs to unite the sectors behind and build the plan, use the SDGs to prioritize the most vulnerable in the society. And so it was very important to raise their voices to the Prime Minister. Latin America, Argentina, they have did also a lot of awareness, and they have that Center for Sustainable Development. And they also made a group that dedicated to the manufacture of some products and for the homeless in the temporary lines. Brazil, we will hear from Brazil. She is with us already. North America with the Caribbean. Barbados did also women's shelter, and Cayman Islands, they did donations. So having really seen how important our organization has contributed to the whole over COVID, and you saw multiple from all over the world. Now is the role of BPW Canada really to compile all these together and give us the statistics about the real impact of the COVID across the whole world, and to have this survey of today that we will hear from you in this webinar to build on it, and really we want to submit it officially to you, Anna, to see how we as BPW International have convened this research and this survey and handed you the effect of BPW of the COVID on economic empowerment of women and how it affected the economy, the small medium enterprises, the real action, and what we need from you as UN women to advocate with us in order to make sure that our voices reach to the world. I also advocated for you ladies with all the heads of states, the African Union, 55 members. I've addressed the heads of states 2 days ago during the African Union Summit and asked them to give special preferential treatments for the women entrepreneurs with reference to public procurement and financial inclusion, because they have really been affected. So having said that, I thank you again, and I'm looking forward to hear all of you. Thank you very much.
Thank you very much, Dr. Amani. So time to move on with our program. The gendered economic effects of COVID-19. And our first speaker in this panel is Anna Felth. Anna heads the Secretariat of the Women's Empowerment Principles, an initiative of UN Women and the UN Global Compact. She manages the EU-funded program We Empower through responsible business conduct in G7 countries. As an economist, Anna has more than 20 years of experience as economic advisor within the UN system. Over to you, Anna.
Thank you so much, Catherine, and congratulations to all of you. I'm so impressed by seeing all the efforts out there. And I previously put a link in the chat box. We have an event tomorrow that we have called The Power of Working Together. And this is like the essence of BPW Network, really how you have shaped this together and how everyone is moving the needle on the ground. So congrats on that. And I'm very excited to take this partnership forward, and hearing all the 68 pages of a lot of information. And I also look forward to hear more details and the analysis of the BPW survey, because that I think, so I hope that I will be able to add to this, because you've been all involved and really know the issues much better than I. What I thought I will do is a little bit from our perspective, what we've seen and heard. And we actually, tomorrow, we are launching a publication together with IFC, where we have compiled what the private sector have been doing. We received about 90 survey responses from companies, and we selected about 40. And we are featuring them in this book that will, or booklet that will be launched tomorrow at this event. But I wanted to touch upon a few things. So yes, I am an economist, but I also have worked on different issues, health, economics, and other issues that we're seeing. So I was just looking, actually, in April, we quickly prepared guidance for our web signatories on how they can respond to the COVID-19 from a gender perspective. And we said that the COVID pandemic is not just a health issue, it's a profound shock to our societies and economies, and women are at the heart of care and response effort underway. But what I wanted to point out, even though we have looked at the health workers and we've looked at the safety of those health workers, I think we are coming a long way with looking at the different impacts, and I will talk a little bit about those. But I want to come back to the health issues, because the economic issues have had health ramifications. So we see both young people, and we've seen an increasing number of studies and articles in the news that are saying that those young students at the university are suffering mentally around the fact that they are forced to have social distancing. It's the essence of being young, is to be with other young people. And we've seen increases in suicide attempts. So I think we need to keep the whole holistic approach to this pandemic. And I can also, on the health side, also see that there's a lot of health checkups, health treatments that have been delayed. I live 2 blocks away from our health center, and there are blocks of lines of people waiting outside to see doctors. People are afraid to go into the hospitals because they don't want to be exposed to the virus. So they are standing outside, and now it's very cold here in New York, and they're standing outside. A lot of people are waiting to just see a doctor. So this will also have ramifications. I've been lucky because I have my doctor on Zoom, but there are those things that can't happen only virtually. You need to have proper checkups, and I think those are being delayed. Another element on the health side is also the fact that when the schools were shut down here in the US, and I'm sure in many other countries, many children are suffering during summer holidays because they don't have enough food. The families are too poor to have 3 meals on the table every day, and they have relied on the school system to provide nutrition and food to the children. This is another effect that we've seen for those children that have been confined at home, that there's not enough food on the table. And this is in a country like the United States. So I can just imagine how it is in the rest of the world. What we also have seen is dropouts from school, particularly girls who have not maybe the same type of access to the internet, and might not have been able to. Actually, we saw here in my county, there's about a lack of about 90,000 devices to be able to attend online schooling. People are dropping out. When they're falling behind, they're dropping out. And when things go virtual and the virtual system is not set up, either from device or connectivity, we have a big problem. But I'm sure you know many of the other issues in terms of people working from home. We in UN Women have called it the shadow pandemic, where women have been confined to home. They've had the choice to go out and seek support risking being contaminated by the virus or stay home with an abuser. And we saw at least during the lockdown, a huge spike in violence against women. We've also seen that women continue to be the ones taking the burden. We know about the unpaid care work burden, but that has really increased the difficulties for women to balance work and life. And many, we've seen here that women are dropping out of the labor market because they can't do it both. The questions is then really what will happen once we go back to normal? Will these women find jobs again? We heard also from your presentation, Amani, about the supply chain, and the supply chain is also a big concern when some of those supply chains have been cut and people have been dropped out, but it's also an opportunity to really bring in new suppliers into this. I'll speed up, Catherine. I want to talk about just one point around resilience. What I've seen from those that have been resilient and been able to really ride the wave of this pandemic are those that have been connected, those that have already had a virtual presence, or those that have quickly pivoted to have a virtual presence in their economic activities. In the booklet that I say that we are launching tomorrow, you will see a lot of very interesting cases, but I just want to highlight one, which I thought was quite unique and innovative. And it's a company in Kenya that actually said, oh, how do we keep the kids busy while the women are working? So they came up with a virtual program so that parents could keep the children busy on different things with different activities. And I thought that was quite important. But also the importance of really understanding women's needs at this point in time is surveys like your own, but also employee surveys and other type of surveys to really understand what are the employees' needs. I want to finalize just this talk with just some points on what is it that we want to keep. We don't want to definitely not keep the coronavirus, but what are the practices that are being put in place that we want to keep once we go back to normal, and make sure that we not go back to normal, but that we keep those elements in. And I think one is about empathy and compassion. We've seen that there have been increased empathy and compassion from in organizations, among people, solidarity, and looking to see how we can help and purchase more from women entrepreneurs. Family-friendly workplaces, because there are measures that have been put in place, along with wellness programs. A lot of companies and employers today have wellness programs. How can we make sure that those stay intact, and that now once we are out of this pandemic, that we are not canceling those programs. We've also seen the companies have, because now domestic violence is also workplace violence, that they have paid attention to that. We also tomorrow will launch our Webs Learn platform, and online learning. We want to make sure that it sticks. And finally, just on a personal note, I just wanted to say that I was always dreaming about having an online conference. And I think a year or 2 years ago, it was not even a possibility of organizing something, a whole conference online. Today, it's actually more than not to have these virtual discussions and have sessions like the ones we will have tomorrow. I'm looking forward to really hearing about the survey and learn more from all the work that you've been doing. And thanks, Catherine, for your patience with me going over the time allocated. Thank you.
Thank you very much, Anna, for your comments. Next, we have in our panel Dr. Choi, Dr. Kate Choi. Dr. Choi is she's Associate Professor of Sociology, Acting Director of the Center for Research on Social Inequality at Western University in London, Canada, where I am as well. Dr. Choi is a family demographer, inequality scholar, and quantitative sociologist. Part of her research examines the causes and consequences of social inequality, including inequality by race and socioeconomic status. I heard about Dr. Choi's work in a print article and later an online event about the forgotten ones, the ways COVID-19 is making global inequalities worse. As a side note, I'd like to thank Dr. Choi for very kindly helping us with designing the questions for the survey. You'll hear more about the survey next, after Dr. Choi. Over to you.
Thank you very much for the kind words. And I have to echo Anna when I say that I'm really impressed by all the different activities that you have done for across the world. I'm sure that it's making a really large impact. So in the very beginning of the pandemic, it was COVID-19 was termed the great equalizer, affecting the affluent and the poor alike. But as the pandemic has progressed, we have come to discover that that is not the case. And COVID-19 is also amplifying inequalities across gender. Today, I would like to speak with you about the She-cession, how COVID-19 is amplifying the economic inequality for men and women. Then I would like to talk to you a little bit more about unpaid burden within the household. Lisa, if I may have my slides. Thank you very much. So in next slide, please. So as I indicated earlier, women have been hit particularly hard by COVID-19. And although women account for just under 40% of the global employment, they constituted 54% of the overall job losses. And if we actually look at recession since 1949, and the reason why we're looking at recessions in 1949 is because it was the first time that it was recorded. It is in fact unusual that women are affected more by COVID-19 than men. And in fact, in the next slide, we can see that since 1949, in all cases, men have lost jobs at higher rates than women. But for this particular economic recession, women are losing jobs at a higher rate than men. And this is why COVID-19 and the economic fallout from it has been termed a she-cession. So in the next slide, we can see what impact the she-cession has had on wages overall. So on average, prior to the start of the pandemic, women on average, and this is for the United States, were making about 86 cents to the dollar. And what we have found is that now during this time, in the first three quarters, women are on average now making 74 cents to the dollar, and is expected to continue to make that for at least another 2 or 3 quarters, economic quarters. This is in contrast to prior recessions where women's earnings relative to men actually increases during a recession, in large part because men work in sectors like construction that are more vulnerable to cyclical changes, including a particular recession. So McKinsey has found that if no action is taken, global GDP growth could be $1 trillion lower in 2030 than it would be if women's unemployment similarly tracked that of men in each of the sectors that they're working. So there are 2 implications of this. First and foremost, it's not only the case that women are working in sectors that have been particularly hit hard by the COVID-19 pandemic, it is in fact the case that even within sectors, it is the case that they are losing jobs at higher rates. And it's also the case that the $1 trillion decrease in GDP growth suggests that what we are seeing in terms of the she-cession is not a women's problem. It's a social problem that governments, as well as intergovernmental agencies, have to really address to ensure social well-being for all. So in the next slide, what we see is that part of a big reason, as Anna indicated earlier, that women are experiencing she-cession and gender inequality is on the rise due to the COVID-19 pandemic and its economic fallout is in large part because unpaid care have increased much more for women than it has for men. So once again, a survey by McKinsey and Leone found that female employees found that 25% of them were considering either reducing their hours or leaving paid work during the pandemic, in large part because they felt like the rise in burden of unpaid care was not compatible with the different companies and flexibility and their willingness to adjust for the caring responsibilities and stress that emerge because of the added burden of assuming more unpaid care. And in the next slide, what you'll see is that that women, if you actually look at the number of hours that were increasing, so women were on average working about 10 more hours, 35 hours to men's 24 hours in terms of unpaid care and domestic work before the pandemic. But during the pandemic, women are now assuming an additional 29 hours. So the amount of work that they're doing on average, according to this survey, is 64 hours. That's, as all of us know, that's equal to a full-time job, in addition to the paid labor market activities. And although it is true that men have had to also assume more work, it's their overall number of hours that they're spending in unpaid care and domestic work increased by 50 to 50 hours. And what that means is that women are now having to kind of balance and juggle two full-time jobs, their jobs in terms of domestic work and in terms of unpaid care, as well as their full-time jobs as professionals in the workplace. So in the next slide, we know that not all women are affected equally by the COVID-19 pandemic. As I indicated earlier, because a large portion of it is unpaid care, it's in fact the case that women with caring responsibilities are affected more. Poor women are affected more because they're more likely to be essential workers. Racial minority women are affected more either because of their marital status or the types of industries that they work in. And in the next slide, we also know that women with school-age children are affected more. And this is observed quite a bit in developed and developing countries. There's also fear in many women's organizations that pregnant women would be pushed out to positions that are furlough positions or redundant positions. And there's also fear that because unpaid work is being increasingly associated with women, that women may be less likely to be selected for management positions. So what can we say in terms of potential solutions? So one option, as many of us know, may be getting a little bit more flexibility in terms of the work, allowing the work for women to be able to balance their unpaid work as well as their paid labor market. But this has to come with the understanding that flexible work tends to be a lot more precarious for women, precarious than something that is 9 to 5 and so forth. Government should invest more on child care centers, right? We know that the COVID-19 pandemic care crisis. And finally, the financial stimulus packages have to take into account the family circumstances of women, including the number of children that they have, whether they have a partner to kind of balance their activities. And with that statement, I conclude my presentation. Thank you very much.
Thank you very much, Dr. Choi. There's a question in the chat about whether we can provide the slides after the presentation today. You're
Yes.
muted. Okay, great, thank you. And I think as well, there is a plan that the video of today's event will also be posted on the BPW International website. So the whole program will be available as well.
Yes, true.
No?
Yes, true. We'll post it.
Okay, yes. So now I'd like to turn it over to the program over to Lisa, Lisa Conley, to present the survey results as far as so far anyways.
Yeah.
Over to you, Lisa.
Hold on. Okay. Thank you, Catherine. There were 39 respondents to the survey, and so my first observation is that we should return to this this very important idea of asking from women around the world what the impact has been, because I feel like we didn't quite get the kind of response that we're looking for, but I think that it was, you know, I think it's a really good effort. So I think that we should redouble our efforts. So you can see that most of the people that responded are from Canada, because this was kind of our thing, but we also got, you know, very good response from Brazil. The first question we asked is, what's your current work status? And you can see that about a quarter of the people are currently employed full-time, about a quarter are currently retired, and about a quarter are business owners. So then we had some other people part-time and working on volunteers. This particular question, more than one was possible. So we have retired people that are volunteering and employed people that are volunteering, but this is how people are spending their time as far as work. This is hard to read. I couldn't get the letters to be bigger, but basically about half of the people that are working from home. About a third of people are working outside the home for an employer. And then we had a fair number of business owners and retired people that also answered the survey. So you can see, as mentioned by Kate and Anna, the working from home has been a very important result of being able to do it. Has been a very important thing to keep employment high. The next question was, if you're not working now, and we're in January 2020, why aren't you working? And we had 4 people that said that they chose to stay home because of safety concerns. We had a couple of people say that they chose to stay home or they didn't choose to stay home. Their employer ended their employment. And the last one said that they retired. This isn't a high number, but this is, thankfully, the people that responded to the survey, there aren't that many that have stopped working in this COVID time. But you can see that people did make the choice to stay home given their situations in their particular countries. The most interesting question of the survey was the question, compared to just before COVID, how has your employment situation changed? And I note that 29% said somewhat better, and 14% said much better. So this says to me that we have an amazing group of women, part of BPW, that have gone out and done the pivot and either, you know, have gone to the online perspective or have changed their business, but you know, a very large percentage say that it's better or much better. Almost 40% say that they're about the same. So if we look at worse and much worse, you know, less than 20%. So that's actually pretty heartening as far as the survey result. So there were questions on the survey about that addressed what Kate was talking about the increased burden of household work, but there was just too much diversity in the answers to kind of pull it together in a format to present. So again, that's an area that I think we should continue to explore and be able to take that data and advocate for women based upon that. that. So we're going to touch a lot more on this. There was a question that's saying, what is your BPW club doing? We've gone through a lot of this when Amani was talking about what BPW organizations are doing around the world. And so I just present it as an entree to the next category when we're going to talk about specific case studies. So the next component of this agenda is to take questions. Catherine, did you want to do the questions now, or do you want to hold them and start with the next section?
Are there chat questions? I didn't see any, but I wasn't really following.
I have not seen any chat questions come across.
Okay,
Do
so
people
then,
yeah, go ahead.
So if we don't have any questions yet in the chat, so while we still have our panelists available right now, while people are, it's still fresh in your mind, if you have questions, send them in the chat. And okay, somebody is.
I did have a couple of questions prepared for the presenters, but if you'd like to move on, to the next section, we certainly can.
Okay, someone is typing a question, but it hasn't come through yet. So, okay.
Catherine, could I say it, because my voice is better than my fingers? It's Sylvia Perry.
Okay.
Yeah, I'm a trustee of a charity, and we have a staff working in offices, and we were all home working during the carried on, but home working. And the thing is, one of the things that I've been very concerned about, and I've made sure that's happened, is that we've checked on the health and safety conditions working at home, both in terms of equipment, how their space is, and also their mental health, the wellness, etc. Has that come into the survey at all?
That was not a portion of the survey, and I think that is an excellent addition to asking about safety, because that, as highlighted by both Anna and Dr. Choi, that is a big concern that we have specifically for women.
Yes.
I think maybe, as I mentioned, ladies, that we have started this survey as a nucleus. So maybe this is very important, what past International President Sylvia Perry is saying, that we can embed it within the survey. We want to make it more wider, and then we have more results, because this was only like a taste of this survey. So maybe also when we receive more questions, we can restructure the whole survey and send it to wider audience. And we have a deeper thinking, a deeper result of the whole effect of the COVID.
Yes, I think that's a great idea. There wasn't a lot of time for people to respond. By the time the survey was distributed, it was less than a week before we asked for responses. It was only about a week ago, I think. So, or maybe 8 or 9 days. So we certainly, I see there's some suggestions here about expanding and revising the survey, but certainly giving a bit more time for people to respond so that we get a wider range of responses, and possibly considering modifying the questions to take into consideration some of these ideas, such as what you're talking about, Sylvia. So thank you for that.
I'd be very glad to give you some more information about it, because there's the impact of schooling children and all sorts of things like that as well that came into it. Mm-hmm.
Yes. And all of that is important to capture. And as I went through the survey myself as a respondent, I realized there were some questions in my mind about our questions. So, I think it was a start, and we can certainly develop that further. I would like to move on in our program. So let's move on to the second part of our agenda, which is the topic of the way forward. When we designed this, we didn't want to sort of stay at that place of how bad things are with the She-cession, but to encourage all of us to think about what are the next steps? How can we move forward most effectively? And so we've brought together a few samples of from BPW clubs that have been doing advocacy and assistance, various kinds in different parts of the world. And our first speaker in this section of the agenda is Margarita Yasuda, who is the president of BPW Brazil. She's going to talk about two projects of BPW Brazil, Women in Parliament and Activism Against Gender-Based Violence. So thank you so much for joining us today, Margarita. You're muted. Can you unmute, Margarita?
Okay, now I'm ready. Okay, thank you. Good afternoon. Thank you so much for this invitation. I'm very honored and delighted to be here with all of you. During all this period of COVID-19, BPW Brazil Federation with 22 clubs has been working very hard to keep members motivated, healthy, and doing their business. One of our greatest achievements was digital inclusion of our members all over the country, remembering that Brazil is a continental country. Since beginning of lockdown, many professional members are giving psychological support in a volunteer basis for our members. And in many occasions, to keep mental health, we organized entertainments such as happy hours, musicals, birthday party, candle ceremony, talk shows using Zoom platform. When friends and members can meet, talk, see each other virtually, and develop a feeling of hope, belonging, and friendship. It was very important, all these moments. The pandemic period was brought us the sad reality that unfortunately, Brazil is the 5th country where women are killed. Reports showed that from January to June of this year, 1,890 women were murdered. BPW Brazil, with its Committee of Women's Rights, decided to take some actions to increase awareness, share knowledge, and advocacy efforts to defend women's rights. But what kind of actions, measures could we do in time of retreatment inside home? Taking responsibility as women's organization, BPW Brazil has engaged in the campaign 16 Days of Activism Against Gender-Based Violence, a campaign supported by UN Women from November 26, ending on December 10th, tomorrow, Human Rights Day. A slide, please. Many members promptly started putting cards in their social media supporting these actions, as you can see in the screen. On November 3rd, at Caçador, a town of 70,000 people in the south of Brazil, a young woman, aged 22, was murdered by her ex-husband in front of her 2-year-old son. People were totally shocked with this tragedy. The company where the victim worked and other organizations contacted BPW Caçador asking for some kind of support and help. They got to know by internet about these 60 days of activism launched by BPW. BPW Caçador, jointly with BPW Brazil, released the media a strong note of repudiation and indignation, followed by a strategy to call for prevention and elimination of violence against women. President of BPW Caçador and members organized a motorcade with more than 400 cars crossing the town and ending the protest in front of the house where the victim lived. Now, the question is, what we women can do to end this violence and all this murdering. USA, can you show the video?
Do you not see it?
No? Oh, I don't know. I'm not seeing, but others? Everyone?
I'm seeing the video.
Yeah, okay. So, USA has elected its first woman vice president. It can be a big challenge getting more women in the parliament, where decisions are often taken mostly by men who are not sensitive to women's rights. This year, we observed in Brazil an increase in the number of female candidates for parliament. For the first time in BPW Brazil, we had 17 BPW members as candidates for city councillors, vice mayors, and mayors. These members were brave to face a political campaign with all these restrictions due to COVID. It was a big challenge. Empowering women in politics is an opportunity to get rid of the old archaic system. We fully understand that more women in the parliament can make a difference, can bring changes that we need in our country. Women are more protective and sensitive in giving solutions when or where women and children are directly affected and can benefit the entire society. More women in the parliament can create impact and ensure attention to all this never-end violence, also showing new perspectives to the public policy with improvement of education and health system, and of course, less corruption. So, ladies, let us all together work to build a better world and build a more gender equal society. Thank you.
Thank you very much, Margarita, an inspiring presentation. Next, we have joining us Agatha Johnson, who is president of BPW Freetown in Sierra Leone. And she is going to talk about her club's project, Women on Board. Thank you so much for joining us, Agatha.
Thank you very much. Good afternoon, ladies. My time, it's in the afternoon. It was in 2017 that the International Finance Corporation forged a partnership with the Sierra Leone Chamber of Commerce to develop a Women's on Board program as part of a governance structure for women. And I was asked to be a member of the task force to set up the structure and develop a form of organization to promote the various programs and events under the Women on Boards program. The Women on Boards program, at the launching, it was for the board diversity agenda. Boards across sectors committed to increasing diversity in their board makeup, because we realized a brief survey showed that 70% of the boards, corporate boards in Sierra Leone, comprised only of men. Women were not invited to join corporate boards, or the women are not even aware that they could join the boards. So as part of the World Bank Group, the IFC launched the Board Diversity Agenda in June of 2018. And interestingly, there is a seminar ongoing right now as part of that program. The program over the past 2 years included training women who see themselves as potential board members to one, understand what being a board member means and the responsibilities that come with board membership on an individual and collective basis. Also, for the women to feel empowered to seek board membership and to able to challenge existing stereotypes and to be the change agents needed to promote board diversity across sectors in Sierra Leone. Thirdly, we want the women to better understand the strategic board policies, procedures, and operations, including conflicts of interest, establishing good levels of board skills, etc. Last but not least, we want the women to understand the importance of having practical accountability and transparency mechanisms, including board and organizational. So we've organized a number of seminars for women on boards. The first set of seminars was on the theme, board roles and responsibilities. This was followed by another set of 4 training seminars on accelerating gender diversity on boards, gender dynamics on boards, strategies for igniting change, and closing the deal. These were some of the modules. Over 60 women, including BPW Freetown members, over 60 women have been trained during these seminars. We have not only trained, but we have also mentored women who have already gained board positions in Sierra Leone. The network continues to keep track of the trained members who are being recruited. Having trained them, then we promote or advocate for their acceptance or for their selections into various boards in Sierra Leone. So that's one project that I want to talk about, but let me quickly also add to what we've done during the COVID-19 program, because we have made donations, and I will quickly touch on the way forward on what we are planning as a club in Sierra Leone. During the pandemic, the earlier part of the pandemic, around between May and September timeframe, we saw it fit to help women at whatever level, because that's what we want to empower women. So during the height of the pandemic, we partnered with the Freetown City Council, met with the mayor of Freetown City Council, and made a donation of 8 wash stations. Each station is like 200 liters, that can take 200 liters of water, and several bottles of liquid soap. We were very specific when we made that donation in May of this year. We said the wash stations should be placed in various marketplaces, and they were specifically for the market women and the children, because there is generally lack of water. Access to water is a problem in Sierra Leone nationwide. So we made this donation, and it was well received because the mayor has a very robust Transform Freetown program. So we were well received. In addition to that, we adopted, BPW Freetown adopted a corona treatment center, which saw maybe 20 to 40 patients on a weekly basis. And we provided several packs of toiletries. We took the decision and said it would be nice for the patients as they go in for their testing and their treatment to receive a pack of toiletries, soap, toothbrush, toothpaste, towels, and they were really appreciated with that. We made 2 donations to the Corona Treatment Center. But on a more positive note, I must say that Sierra Leone as a country has been recognized as one of 4 countries worldwide with minimal COVID, what's the term, occurrence in recent months, to such an extent that if you move around Freetown, very few people will still wear the mask, although nobody has announced that you shouldn't wear masks. But we do not have the large incidence of COVID anymore. The treatment center that we adopted has 1 to 5 patients weekly. So you can imagine coming from 40 intakes to 1 to 5 weekly. We are very, very pleased. Finally, on the way forward, we are planning to develop skills training programs for about 500 young women. Skills training in areas of makeup and skincare, bag and shoe production, marketing and packaging, pastry and cake making, just to enhance their skills and income generating activities. Thank you very much for permitting me to make this presentation. Thank you.
Thank you very much, Agatha. And it sounds like a busy and very practical kind of focus to the work that your group has been doing.
Right. Thank you.
And our next speaker in this section of the agenda is Géraldine Crevin. Géraldine is based in France. In 2013, she founded and chairs the monthly intercontinental online meetings on behalf of BPW International. Since April 2020, she has used this platform to talk about COVID-19. Thank you for joining us, Géraldine.
Oh, thank you very much, Catherine. So it's a real pleasure to be with you all. I heard very good things today, and I would like to share with you this experience with Intercontinental Online, BPW Intercontinental Online meetings for COVID, for this COVID period. So I am used to organize, to schedule some virtual meetings since a long time. But in March, April, I heard about from BPW members all the anxiety they have about this COVID and this new situation. So I decided very spontaneously to do a special meeting about COVID, but it was only once, so I didn't plan to do many. And in fact, the ladies asked for me to do many, and we did 9 meetings, intercontinental online meetings since April. And during these meetings, the lady could share many good practice, many information about the lockdown, the government measures, or the UN recommendation too. And we have many BPW members who are doctors, so they can come and explain about their expertise, how they feel this experience. And in fact, it was a group more to highlight this psychologist aspect, because it's very important, I think, for this solidarity across countries, and especially to share cross-cultural good practices. And I think it's a very good initiative, this survey you did in Canada, because I think it shows that women have to face many and more things during this period. And especially you approached every topic, especially with violence at home, with kids, and more housework, and the homework too for because women don't know very much Zoom meeting, how it works and so on. And it was very nice to, I would just want to share this feeling because it was very important face to this powerlessness to be together and to join and to speak about this. So this is just I want to say, and thank you very much for your attention.
Thank you all very much for your presentations. Now is the part of the agenda. We have about, about 8 minutes or so for your questions. So I'm going to ask you to please keep your questions to short questions, a minute or less, so that we can try to give as many people an opportunity to ask questions as possible. So if you want to ask a question, I think some people have been sending chat to Lisa. And also you can use the raise hand button that you practiced earlier to indicate if you want to ask a question, and Lisa will unmute. So do we have somebody queued up with a question?
We don't. There have not been a lot of chat things that came in. One general thing that came in that I would like to ask of the group, and I'm going to take you off the spotlight as well, Catherine. I'd like, one question that somebody asked is, we haven't talked a whole lot so far about entrepreneur and business support. And I know that from the survey results, I know that from what Dr. Amani covered at the beginning, that clubs are working on supporting entrepreneurs and promoting women in their businesses and that kind of thing. So let me just open it up for the floor, to raise your hand, the old-fashioned way, and I can highlight you and you can talk about what your club has been doing. I saw a hand. Here we go. Chris McDonald. I'm gonna give the floor to you. I'm going to. Can you unmute yourself, Chris?
No.
Oh, there you go. There you're unmuted.
I'm unmuted. My God.
Yes.
That doesn't happen very often.
So has your BPW club been doing things to help entrepreneurs?
Well, we've been trying because of the difficulty. I'm with BPW Bowmanville and I'm in the process of transferring to the virtual club. I'm moving from where I live now to back to Toronto. So what I'm thinking about is, as women are confronted with this whole issue of why are we still bearing those burdens that we can't get anybody to share.
So more a message of empowerment, you're asking. Why don't we just, I think that's so true that there's not going to be equality in the workplace till there's equality at home. And what kinds of choices are individual women making to take on the burdens rather than to share them? Is that the?
Yeah, well, I can remember now, I'm a widow now, but I can remember at a certain point going to my husband, who was sitting in the living room reading the paper, watching television as I was cleaning up dinner dishes. And I just said to him, even paid help, even servants are allowed one day off. So could I get you to fix dinner and clean up one night a week? And it changed his focus, because all of a sudden he looked at it like, particularly since we had the same profession.
Yeah.
And just approaching a man and just saying, could I have a day off?
Yeah. Yeah, that's a very empowering idea, Chris, and I thank you for sharing it with us. Are there other people that would like to jump in and either offer a question or offer an observation, offer what your club has been doing for entrepreneurs and business people? I'm looking for hands being raised. Oh, Sylvia.
I wanted to just contribute something from the UK about what I've heard quite a bit of lately here, is that women who've lost their jobs, either been furloughed and then lost their jobs, or there's enormous loss of businesses here, large businesses, and people, thousands are losing jobs in that sense. But there's been a big uptake, really, in women turning round and forming their own businesses. It's been a very good period of time of that. And that's something we could encourage, that if there's an opportunity of women to find, instead of just being unemployed and have to be faced to be in the home, if there's an opportunity, because women are creative and they're thinking of new ideas on what they can do, and taking that up. So I'd like us to see us being some supportive of women and encouraging them to do that.
Yeah, I think that's a really good observation, and I would open the floor to any clubs that have been able to do that kind of thing. One of the survey responses that I read last night, it was in Brazilian, but I think what she said was, "I lost my job, but I started a new business." I did the Google Translate, so I open the floor to thoughts on how to support women and women-owned businesses. Raise your hand. Yep.
It's Sheila here. I guess one of the things, rather than sort of actually describing what we are doing or attempting to do, I would like to pose the question, as Sylvia's indicated, and your survey results indicate, what it is that the entrepreneurs, the women who say they are doing better, what it was specifically that they feel helped them do better. What are their supports that were offered? What were the assistance that they received to allow them to feel they're doing better? And equally, those who felt that perhaps they were not able to access or get the supports they needed, what were those? I think that information, anyone on the call today who can provide some insight into those two aspects would be really helpful.
Yes, I think that is being able to share in the success stories, I think, is a really important component, because that was a pretty startling part of the survey, that things are actually better for a significant number of women, and going back and saying, what was it? Was it your your inner drive, or was it a some kind of club initiative, government initiative, etc.? Other thoughts, ladies? Yes, Linda.
Yeah, just to build on that question, that
you're on mute.
Oh, no. It says I'm unmuted.
There. Okay. Yep. Now I hear you.
Okay. Just didn't have the volume turned up. Okay. Yeah. Just to build on what Sheila's question was, things are better for me. I'm working with a government grant that I didn't have before. It just coincidentally came at around the same time, and so financially things are better in my house. Secondly, I was speaking to a woman yesterday who does diversity and inclusion work, has her own business, and she also was able to access a government grant. So she has now created some toolkits and some things that she will, actually she said she just upgraded her website using government grant money. A beautiful, beautiful website. So I think that here in Canada, at least, there are funds available, and I think that people can take the opportunity, if they do, to really better their business and sort of step it up so that once COVID's done, they're going to hit the ground running. So that's one of the things I think is helping in Canada, at least.
Thank you, Linda. And I note that that's a similar, to draw out something that one of our, Anna Falk mentioned, is keeping what's good. There are definitely silver linings of the current impact, and keeping the good, doing the building and that kind of thing is really important. Other thoughts? Agatha, let me unmute you.
And let's have Agatha be our last questioner, because we're
okay.
Just
it's not a question. I wanted to elaborate on a proposed program that I mentioned when I was giving my speech about skills development, and it will be entrepreneurship skills development for young women, which we are planning to start in the new year. And we are targeting between 200 and 500 young women, mainly unemployed, and who also, because of not having the required skills, they need to be trained. So we are looking at the tourism sector, which has been badly hit. Once we hope the pandemic dissipates, that's the term I use, and we get back to some normalcy, the tourism sector will need a lot of waitresses, maids, housemaids, and cooks and cleaners. So we'll be training them to get employment in hotels and restaurants and guest houses. So that's a project. In addition to that, for those who want to start their own business, we will be having a series of training seminars with EcoBank, which is a Pan-African bank that has a microfinance component to it. We were planning to have these seminars, but of course, the COVID did not allow us. But in the new year, we hope to have some financial inclusion training seminars for women. Because the CEO of EcoBank Sierra Leone is a woman, and she understands the problems of women entrepreneurs. Thank you.
Thank you very much, Agatha. I think that there are many countries around the world that microfinance is crucial to women-owned businesses. I just note that in the chat we had another woman point out how important self-care is in this time, and would encourage activities from the clubs to support one another in this very difficult time, and making sure that women aren't doing for everybody else, but are also taking care of themselves. Catherine, I'm going to turn the floor over to you to wrap this up.
Thank you very much, Lisa. And thank you everybody who's spoke and asked a question. Our time has really flown by. So now it's my turn to turn the virtual microphone over to Kelsey Gill, who is the president of BPW London, the club where Lisa and I are members. And Kelsey is going to start the wrap up of our program today. So Kelsey.
Thank you so much, Catherine. And it is so incredible and inspiring to see so many women on this call today. So thank you everyone for joining us from all parts of the world. It's so inspiring, as I said, and we're very grateful that you were all able to attend and partake. It's great to get the different perspectives and voices of everybody. I would like to specifically thank our speakers, Anna, from the UN, the comments that she had to share with us. I particularly, what stood out to me was that the COVID pandemic is not just a health issue. And I think that was a great lead in to everything that we had to discuss today, that this isn't just about the health issues. This is about the impact in particular on women. And every speaker, as you saw, got into really some of the elements of the way this has impacted women. Dr. Kate Choi really focusing on how this is a social problem. And the dramatic spike from the statistics that she shared with us in the job loss that women have suffered in particular since the pandemic, and women really being the ones that have to step in for childcare and the care in the home and taking care of everything. Just really interesting to get those different perspectives. It was great to hear from Lisa in terms of the survey that we sent out. As was addressed, I mean, it was a short time window, but it gave us a little bit of insight. It started the conversation for us. And as everyone has said, I think it's definitely something that we need to push forward and continue to talk about, because there's a lot of different pieces in there that we can really kind of unravel and explore further. So that was excellent. And then moving into the way forward, it was the things that BPW women around the world have done and achieved and pursued to assist our sisters everywhere, locally, nationally, and internationally, is so inspiring. It goes back to the booklet, pamphlet package that Dr. Amani indicated early on about all the different projects that BPW women have undertaken, and it was incredible to hear from BPW Brazil, Sierra Leone, and the Intercontinental Online meetings for what's happening, for what we're doing. And for those of us who weren't involved in those, it's a great opportunity to give us some things to think about that we can take back to our own clubs, our own communities, and really find ways to keep this momentum that we've started today moving forward. So just as in conclusion of all of that, thank you again to everybody, to our speakers, to Catherine and Lisa, who really spearheaded this, along with Dr. Amani, our BPW International President, and Karen, our BPW Canada President. Thank you to everybody, and thank you to all of you for attending. It's been a fantastic event, and we're so glad that we were able to start this conversation with you.
And now for some final wrap up, Dr. Amani Asfour.
Thank you very much. Thank you, BPW Canada. We made it. I am so happy, Karen and Kelsey and Catherine and Lisa, because of all our night talk at 3 o'clock in the morning and 2 o'clock in the morning. Now it has been a very fruitful webinar that everybody's there, and we really have focused with this survey on a very big a cornerstone about BPW International, how to have this survey really now replicated across the whole world and make more deep into it, and to have more responses, and then we can hand it to Anna with UN Women and make it a great publication across the world, because this is us as BPW International. Together we work. And I remember Karen, my dear Karen, the President of BPW Canada, when she first approached me to do this webinar, I was so excited, because this is really how we work together as BPW sisters across the world, and we come together. We have lovely heard what Sierra Leone has been doing at the end of the world in Africa for you. We have heard about Brazil. We have heard about Geraldine doing in France, intercontinental meetings. We have heard saw the booklet of everybody. This is really how is the spirit of BPW International. We heard from everybody. We got very good comments from past International President Sylvia Perry. We have had all of you coming together, and I really thank very much Karen, Catherine, Kelsey, Lisa for making it happen. And we make sure that together we are strong, and together we can make it. Thank you very much.
And finally, our President of BPW Canada, Karen Gorgera. You're muted.
Sorry. I would like to everyone involved with the webinar today, and BPW Canada was proud to be a part of it. And we appreciate that all of you have taken the time out of your busy days to participate. We all know what's happening in our regions, but we're losing opportunities if we don't learn what's happening in other parts of the world. So today's webinar has given us this chance, and I hope that we all will take what we've learned back to our countries and to our clubs and move forward with it. So I do wish all of you the best for a wonderful holiday season and a happy and very healthy 2021.
Thank you, everyone.
Thank you. Thank you. Have a good day.
So lovely, lovely time. Thank you everybody for participating.
Thank you, ladies. Thank you. So happy to see all of you. Thanks a lot. Very great. Love you all.
Bye-bye.
Ciao, ciao. Ah, I love the heart, Monique. Thank you for the Monique, for the heart. Ambika, I haven't seen you, Ambika. Lovely, lovely to see you, Ambika. Wow, even Nepal with us here. Ines, wow, that's great. Lovely to see you. And Ines and Chris. Okay, great. Nice.
See all of you. Thank you all from all over.
Thank you, Ambika, for being with us.
Ladies.
Thank you very much. Anna Faith, thank you. Thank you for all of for your participation and for being with us. It's great to be together.
Same here. Thank you so much.
Okay, great.
Fantastic to hear about all your work.
Thank you. Thank you,
Canada, for doing this.
Thank you.
Thank you very much, Canada, and also Amani. Thank you very much, Canada, for doing this work. Thank you. Sharing things.
Great to have all of you ladies. That's fantastic. Juicy, lovely to see you.
Thank you from Italy. Bye.
Thank you. Italy. Thank you for bringing Italy to us, my love. That's fantastic. Thanks a lot. Love you all. Thank you. Thank you, ladies.
Thank you, and Margarita. It was lovely to see Margarita and speaking. Great. Thank you.
Great.
From Brazil.
Brazil, yes. Monica. Lovely, lovely. Ines, thank you. Chris, thank you. All of you lovely ladies. Fantastic. So I love you all, my lovely ladies, and I hope we continue together for more and more education about what we are doing on BPW International. I love you all.
Thank you.
Okay, great. Okay, great. Love you. Love you.
Thank you. Bye. I have to say good night. It's late.
Maria Helena. Bye-bye. Ciao, ciao. Bye, lovely ladies. Ciao. I will just take a photo of all of us now before it's finished. Abika, just wait. I take a photo for all of us together. Okay. Yes. So we can, I will send it to you with all those who are still with us. Okay, great.
Thank you.
Okay, my dear. Okay.
Thank you.
Bye. Ladies, ciao.